Hi all, myself Benosel Paul from SNS College of Physiotherapy. Today we can see about the tetanus. So what is a tetanus? What are the types? And what are the clinical features? And how will be diagnosed? And how will be prevent the tetanus? So tetanus is an acute infectious disease so caused by the Clostridium tetani. So it's produced in the potent neurotoxin. So these toxin leads to severe muscle spasm and rigidity. So commonly known as that lockjaw. So it is not an contagious, but is occur through the wound contamination. So types of tetanus, we have five types: generalized tetanus, neonatal tetanus, localized tetanus, cephalic tetanus, and maternal tetanus. So in generalized tetanus, commonly is caused widely to leads to the muscle spasm. So it's common type, and also it includes that like lockjaw. And neonatal tetanus, it's affect a newborn baby within 28 days. So due to the unsterile delivery practices. Third type is a localized tetanus. So it's any spasm or present in the muscle near the wound site. So it's generally less severe with lower mortality. And fourth type is cephalic type. So it's a rare and affected cranial nerves only. So typically seen in the head injuries or any ear infection patients. And last type, fifth type is maternal tetanus. It's acquire any unimmunized pregnant woman. So large seen in the week postpartum. So epidemiology insight. So tetanus spores mainly found in the soil and dust, and also animal and human feces, and also rusty objects. So it's a risk elevator in region which are low immunization rate. Commonly adult over 70 years of age will be commonly seen it. And its tetanus incubation in generalized and localized type, we have 3 to 21 days, averagely about 8 days incubation period. And neonatal tetanus incubation periods around 4 to 14 days after birth, so averagely around 7 days. And cephalic tetanus, we have a short incubation period, so we have only seen in the 1 to 2 days. So route of infection, so mainly the tetanus will be transmitted through the wound entry. So wound entry commonly that Clostridium tetani so enter the body through break in the skin or mucous membrane. And second is commonly wound typically enter point include puncture wound, burns, crush injuries, and contaminant cut. And neonatal risk, we are neonatal tetanus result from the umbilicus stump contaminated during the unhygiene delivery, and also not transmitted the person to person. So clinical features, so early morning sign is a lockjaw, there's a tremors, so make it difficulty to open the mouth. And generalized, we have muscle stiffness and overall starting with the jaw and neck, and difficulty in swallowing leading to dehydration, malnutrition. In progressive symptoms, we have seen painful muscle spasm which can generalized and severe. And we have a fixed sartoric grin due to the facial muscle spasm, that's a risus sardoninus. And opisthotonus, it's a severe arching of the back which head and heels bend forward. So in addition, we have autonomic dysfunction occur due to the excessive sweating, fever, fluctuating BP, and rapid heart rate also, that's a tachycardia. So stages, we have four stages: incubation stage, prothrombal stage, spasmodic and recovery stage. Incubation stage due to the asymptomatic period following the infection, and prothrombal stage initially mild symptoms but such as subtitle muscle stiffness and jaw tightness will be occurred to beginning. And spasmodium, we can mark severe painful muscle spasm and generalized rigidity also. And recovery is a gradual resolving of the symptoms. So diagnosed, we have clinical assessment and through the laboratory assessment and differential diagnosis. So how will prevent and control? So primary prevention due to the immunization vaccine will be put into the person, that is a TT injection, that's tetanus toxic contaminated vaccination through the overall the over the 10 years to the every person to protect her from the these type of virus, and proper wound care and safe delivery practices should be continued, friends. So tetanus will be preventable, but severe neotoxic diseases can caused by the Clostridium.